We are on Chapter 28, Assisting with the Physical Examination. Remember to study your chapter. You know how to do that. We are going to go swoop on over from the contents. Exams are done to promote health, determine fitness for work, diagnose disease. In nursing centers, residents have an exam at least once a year. Doctors and many RNs perform physical exams. Your role, what you do depends on center policies and procedures, the examiner's preferences. Review the list in the textbook of some of the tests you might perform. Instruments: laryngeal mirror, used to examine the mouth, teeth, and throat. Nasal speculum, used to examine the inside of the nose. And the ophthalmoscope, used to examine the internal eye sculptures. These are the many instruments, equipments, or tools that they use to examine. You have the ophthalmoscope, is at the very top. Percussion hammer. You have vaginal speculum, the tuning fork. You also have the otoscope, the nasal speculum, and the laryngeal mirror at the very bottom. The otoscope is used to examine the external ear and the eardrum, the tympanic membrane. Percussion hammer, reflex hammer, used to tap body parts to test reflexes. The tuning fork is used to test the hearing. And vaginal speculum, used to open the vagina to examine it and the cervix. Some otoscopes can be changed into an ophthalmoscope. Some centers have exam trays in a supply department. If not, collect the items listed in the procedure preparing for the person for examination in the textbook. Arrange them on the tray or table like the center would like to have them. Preparing the person. The physical exam concerns many people. To prepare the person physically and mentally, the nurse explains the exam's purpose and what to expect. The person must give informed consent for the exam. You must be sensitive to the person's feelings and concerns. The person is prepared physically and mentally for the exam. Under OBRA, OBRA, the person has the right to who will do the exam, why it is done, and what to expect. The resident has the right to personal choice. The exam is done only with the person's consent. Preparing the person, again, the doctor or nurse tells the person about the exam, reason for the exam, who will do the exam, when the exam will be done, and about the procedure. Privacy is protected, the person is screened, and the room door is closed. Usually a hospital gown is worn. The person is covered with a drape. Only the part being examined is exposed. Wearing a gown and proper draping reduces the naked feeling and the fear of exposure. Preparing the person again. The person voids before the exam so they will not be uncomfortable. An empty bladder lets the examiner feel the abdomen organs also and promotes comfort, especially when the abdomen organs are felt. If a urine specimen is needed, obtain it at this time. Measure the weight, the height, and vital signs before the exam starts. Drape and position the person for the exam. Nursing residents are told who will do the exam and when it will be done. The person may want a different examiner. The person may want a family member present during the exam and when the results are explained. Weight and height. Weight and height are measured before a physical exam. They are also weighted on admission to the center. The person is then weighed daily, weekly, or monthly, depending on the order the doctor provides. Standing, chair, bed, lift, and wheelchair scales are used. Follow manufacturer's instructions and center procedures. when you use any of these equipments. Follow these equipment guidelines when weighing a person. Use the same scale always when you measure the person for weight or height again. Use only a gown or pajamas and no footwear is worn. Weigh at the same time every day before breakfast is best. Have the person void first. Balance the scale. It should read 0 on a digital scale, and the weights should be moved to 0 on a balance scale. Types of scales. You have the standing scale, you have a chair scale, you have a lift scale, and a wheelchair scale. And as stated before, they do have beds that have scales in them to weigh the individual. Weighing. A person is weighed upon admission to the facility and during exams. Before the exam occurs, though, the weight is read when the balance pointer is in the middle, as you can see. Taking height of a person, which a person, you can tell the person's height is measured on a standing scale. The person's height is measured in the bed. The tape measure extends from the top of the head to the heel. The ruler is flat across the top of the person's head. Before helping the person assume and maintain the position, explain the following: why the position is needed, how to assume the position, how the body is draped for warmth and privacy, and how long to expect to stay in the position. These positions are common: the dorsal recumbent, horizontal recumbent position, the lithotomy position, the knee chest position, and the Sims position. The examiner tells you how to position the person. Some positions are uncomfortable and embarrassing. The dorsal recumbent position, horizontal recumbent position, is used to examine the abdomen, chest, and breast. Review the figures of 28.6 A through D in the textbook. That's what you should do. Number A, you have the dorsal recumbent position, which I said is to examine the chest and the breast and abdomen. B, you have the lithotomy position. It's used to examine the vaginal and cervix area. Some women cannot assume this position. If so, the examiner tells you how to position the woman. In C figure, the knee chest position, which is used to examine the rectum. This position is really used for older individuals. For them, the side lying position is used to examine the rectum. The next one is D, which is the Sims position. As you can see, they're on their side, and the top leg is over the bottom leg. The Sims position is sometimes used to examine the rectum or vaginal also. Positioning and draping for physical exams. You do have the dorsal recumbent position, lithotomy position, knee chest position, and Sims position. I am repeating those because you need to know those positions, okay? You may be asked to prepare, position, and drape the person. Assist the doctor or RN during the exam. Persons with dementia may resist the examiner's efforts, be agitated or aggressive because of being confused and fearful. The person's rights are always respected. You must support the person's rights to refuse an exam. If a person refuses or resists an exam, he or she is not restrained or forced to have it. The exam is tried another time. Sometimes a family member can calm the person. The doctor may order drugs to help the person relax, and the person's rights are always respected. After the exam, assist as needed. The person dresses or returns to bed. The vaginal anal areas are wiped or cleaned before the person dresses or returns to the room. After the exam, make sure the exam room is clean and that supplies and equipment are ready for the next exam. Review teamwork and time management after the exam in the textbook. You also need to discard disposable items, replace supplies so the tray is ready for the next exam, clean reusable items according to center policy, send the speculum to the supply area for sterilization, cover the exam table with a clean draw sheet or paper, label specimens, take them to the designated area with the requisition slip, clean and straighten the person's unit or exam room, follow center policy for soiled linens. Quality of life. The person has the right to personal choice. The person has the right to privacy and confidentiality. The person needs to feel safe and secure. Resident care is given in a way that promotes dignity, self-esteem, and physical, mental, and social well-being. The person should know the reasons for the exam and how it will be done. Only staff involved in the person's care need to know the reason for the exam and its results. If the person consents, the doctor tells the family. The person can share the information with others if he or she wants to. This is the end of Chapter 28 of Assisting with a Physical Examination.